Hi, my name is Dr. Jan Tade. I'm a specialist orthodontist and I'm going to be giving you some instructions on how to put on and take off your retainers. The first retainer I'll be talking about are the clear retainers. This applies to aligners as well. The first thing you need to do is to place your retainer over your teeth so it lines up. The next thing you need to do is push the retainer downwards at the front firmly and gradually working your way towards the back, and it should slot in quite nicely. When it comes to removing your retainer, you must not remove it from the front to start. You need to start from the back, lift it up from the corners on one side, the corner on the other side, and once it's loose at the back, it comes off fairly easily at the front. There are times when your retainers may be a little bit rough in some areas. In this instance, I would suggest you use a nail file to gently file down any part of the retainer which is rubbing. During the course of wearing your retainers, you might find some wear and tear. You may find white marks on the retainers, and sometimes you may even find little holes, and these tend to be where the canines are. If that happens, it is not a problem. You can continue wearing your retainers as normal. If it starts to split at the back and it's not causing a problem, please keep wearing your retainers. The next type of retainer is called a Hawley retainer, and what it has is a wire across the front, a clip on the side, and another one on the other side. When it comes to taking it out, loosen the back clips first on one side and then the other, and it should be relatively easy then to remove it at the front. Do not remove it from the front first, as you may fracture or distort the front wire. When it comes to putting on your Hawley retainers, the first thing you need to do is line up the retainer to your teeth, making sure the wire is in the correct place, and using your fingers, push the plastic in the roof of your mouth firmly upwards until it's seated. The problems you may encounter with a Hawley retainer is the front wire may fracture, and it tends to happen at this point or at that point. If that happens and it's not causing a problem, you can continue wearing a brace. But if it is causing a problem, you can cut. If it's fractured at that point, you can cut it at that point. And as long as it's retentive, keep wearing your retainer. Another problem that may happen with the Hawleys is a clip may fracture, usually at that point or that point. If the retainer remains retentive, keep wearing your retainer. It's not usually a problem and it doesn't tend to rub. This particular brace has a spring in that position. It may be that sometimes the spring fractures. If it fractures but is not causing any problems, continue wearing your brace. If it fractures and is causing a problem, cut it at that point with either a nail cutter or a pair of pliers at that point, and keep wearing a brace.